I'm ready.
Okay. Hi everyone. I'm going to show you how to do a pigtail chest tube insertion. So here's our kit. Everything you need should be in it. So of course this is going to be sterile in a normal life. So you have some drapes in here. You have this regular one. I think it has the hole in it. You're going to have your cleaning solution, and then you have your actual pigtail. So this is what I really want to show you. So this is your actual catheter that is going to go into the patient. This is your dilator. And then this is your initial needle that you use. And this is your wire, your guide wire, that is going to be what helps you with everything. Press stop for a minute. Okay, so first I'm going to, of course, fill for my insertion site. I'm going to clean. Then you're going to take your needle, locate your landmark, put it in at a 90-degree angle between the intercostal space, and you'll feel a little bit of a pop. So you put that in, and then you're going to take your guide wire, and see how there's this little hook on the end. You want to make sure you bring the white piece up, and it kind of will straighten out the hook for you. And you're going to want to insert it into your needle and start slowly putting the guide wire into your patient. And you want to make sure you keep a good tension on that because otherwise it can slide out. So next I'm going to take off this white piece. And so your guide wire and your needle are in. Now keep tension on the guide wire because otherwise it can come out of the patient. And you want to remove the needle. And make sure you're holding on to that well. So all that's in right now is just a small guide wire, and if you see that it's a really small hole, so you need to dilate the hole some. So keep tension on that. And then you're going to take this dilator and you're going to put it through the guide wire to the end, and then you're going to slowly just kind of twist, and all that's doing is making that hole a little bit bigger so your chest tube's going to fit. Make sure you hold tension on the guide wire and take off the dilator, leave the wire in, and then you're going to take your pigtail. You need to uncurl it, and sometimes it's easier to kind of bring down your guide wire. Just always make sure you keep tension on that one side so it doesn't come out. And I kind of bring it down like this so I can get the chest tube onto the end of it. I put it in the guide wire like that, holding tension all the time on the guide wire so it does not fall out. You put it like that. Okay, so now it's through here. You want to kind of twist in the chest tube to go in. Make sure all the holes are in, and once all the holes are in, like that, you remove the guide wire and your chest tube's in. And then you can just suture it like you would normally suture a chest tube.